Hi, I am Sheila Marie Di De La Cruz from BSN 3B. In this return demonstration, I will show and explain the use of incentive spirometry. So the purposes of IS are the following. First, to improve pulmonary ventilation. Second is to counteract the effects of anesthesia and hypoventilation. Third is to loosen the respiratory secretions. Fourth is to facilitate in respiratory gaseous exchange, and lastly, to expand the collapsed alveoli. So, the equipment that I will be using in this procedure is the incentive spirometry. So, I improvised my incentive spirometry. So, this will serve as the mouthpiece of the spirometry, and this is the spirometry itself. So, let's proceed. First thing that we need to do is to check for the doctor's order. Then, assess the patient's vital signs including pain, mental status, and motor impairments. The rationale for this is to avoid medical error and to have a baseline data. Next is to prepare the necessary equipment and supplies. Rationale for this is to save time and effort and to ensure the availability of the equipment. Then, prior to performing the procedure, introduce yourself to the patient and verify the patient using the agency's protocol, usually the full name and birthday. Then explain to the client what you're going to do and why it is necessary and how to participate. And discuss that the results will be used for planning for future care and treatments. So the rationale for this is that introducing yourself to the patient can help you build rapport with your patient. Then verifying your patient's identity helps you to make sure that you are handling the right patient, and explaining what you're going to do to your patient can help to ease his or her anxiousness during the procedure. Then, perform hand hygiene. Rationale for this is to prevent the spread of infection, and lastly, provide patient's privacy. Rationale so that the patient will not feel uncomfortable during the procedure. So, hi ma'am, I am Nurse Sheila. I will be your nursing assistant for today. So, there's an order for you for an incentive spirometry. But before we proceed, can you please state your full name and birthday? Okay, thank you. So, today, we're going to use this device called incentive spirometry. So this device will be a great help for you to improve your breathing and to lessen your respiratory secretions. So this can be a bit painful, but don't worry, I am here to guide you. And remember that we did this before your operation, right? And before we start, I'm going to check your vital signs. So we're going to check your temperature and your respiratory rate. Okay, so your respiratory range is in normal range and your temperature is normal. Okay, so how about your pain? How much will you rate your pain from 1 to 10, with 10 being the highest? Okay, 3. Thank you. So let's proceed. So in this procedure, you need to place your patient in a sitting position or high Fowler's position. So now my patient is in sitting position. So, if your patient is using a volume-oriented spirometer, set the indicator at the target volume level. Rationale for this is that the patient will know the target volume level and avoid confusion or error. So, next is to instruct the patient. Hold or place the spirometer in an upright position. Rationale for this is that a tilted flow-oriented device requires less effort to raise the balls or disc, while a volume-oriented device will not function correctly unless upright. Also, instruct your patient to exhale normally. Also, instruct your patient to seal the lips around the mouthpiece tightly. And take in a slow deep breath to elevate the balls or cylinder, and then hold the breath for 2 seconds initially, increasing to 6 seconds. For a flow-oriented device, avoid brisk or low volume breaths that snap the balls to the top of the chamber. Greater lung expansion is achieved with a very slow inspiration than with the brisk. Shallow breath, even though it may not elevate the balls or keep them elevated while you hold your breath. Sustained elevation of the balls or cylinder ensures adequate ventilation of the alveoli. Next, instruct your patient to remove the mouthpiece and exhale normally. Also, instruct your patient to cough after the incentive effort. Deep ventilation may loosen secretions, and coughing can facilitate their removal. Also, relax and take several normal breaths before using the spirometer again. Instruct the patient to repeat the procedure several times and then 4 or 5 times hourly. Practice increases inspiratory volume, maintains alveolar ventilation, and prevents atelectasis. Atelectasis is the collapse of the air sacs or the alveoli. Next, after using, clean the mouthpiece with water and let it dry. Okay, ma'am, so you're going to seal your lips on the mouthpiece and you're going to inhale for 2 or more seconds until you elevate the balls, and try to hold your breath for as long as possible. And then exhale normally, and when you exhale, remove your mouth from the mouthpiece. Okay, can you try? Okay, so after the procedure, now the evaluation. Evaluate the changes in the result or if the patient is unable to reach the target volume. And for the documentation, document if the patient is able to perform incentive spirometry correctly. Also document the frequency and maximum inspiration volume. And don't forget to document as well the problems, if any, preventing patient from performing the exercise. So that's it for the incentive spirometry. Thank you for watching.